Good morning, ladies and gentlemen. Welcome. 8 o'clock Monday morning. Can't beat it. Can't beat it. Telling you what. All of the commissioners are present this morning with the exception of Commissioner Stroud, and we're expecting him as far as I know. But we're going to carry on. I ask you to silence all your mobile devices. If you've got things that's going to make a noise, please take care of those this morning. Remind everyone as you come to the podium to present, please be sure the microphone is on so that we can hear you and get a good recording this morning in a YouTube meeting. We're delighted to have Pastor Jeff Lovett with us this morning, retired, and man had to get up at 8 o'clock on Monday morning, retired man.
I didn't see that AM.
Oh, you'll look closer next time, won't you? Amen. Okay. We're going to have our invocation. Pastor Lovett's going to do that for us, and we're going to have our Pledge of Allegiance, and Dylan, our Attorney Hall, Mr. Dylan Laws, excuse me, will give our, help us with the Pledge of Allegiance, and then we'll move on into our meeting. So let's stand together and Pastor lead us in our prayer.
It's on, yeah. All right, let's pray. Holy Father, we're thankful that you have awakened us to a new day. We're thankful to be in a land and a country that you have blessed. We're thankful to be under the government of a people that are free. And we're thankful that we have the opportunity, Father, to address you in prayer through Jesus Christ and what he has done for us. As we begin this week, I'm thankful that we have a board that is concerned with doing the work of this county in a way that is beneficial, but also that they're concerned to do it under your guidance. And that is what we pray for today, Father, that you be with these men and everyone, the men and women that are here. And we pray, Father, that the things that are discussed, the things that are decided will be, in fact, of that benefit which is sought. We thank you for Jesus. We thank you for your patience and your long suffering toward us. People of clay feet, but beating hearts. In Jesus' name we pray. Amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, this brings us to item number 4 of our agenda this morning. Approval of the agenda. Gentlemen, you've had the agenda for a number of days. Hope you've had a chance to review it. I'll entertain a motion.
Mr. Chairman, I'll make a motion to approve the agenda.
Thank you. All those in favor signify by the uplifted hand. 4-0, Madam Clerk. Item 5, approval of meeting minutes. There are none to approve today. Item 6, presentation. This is Health Department required training for Board of Health members, and this will be presented today by Mr. Danny Scalise and his team from the Health Department. Good morning, Danny.
Good morning, gentlemen.
It's all yours.
Where's the... There we go. Slideshow.
Yeah, you're right. About 5 past.
There we go. All right. I will apologize in advance, gentlemen. This is a very long presentation, and I'm going to get into a lot of technical things that I'm sure will not be as exciting as you would like them to be. At any point, if you have questions, you're welcome to stop me. This is a presentation that was designed by the North Carolina Institute of Public Health, and that is housed at UNC Chapel Hill. This is all about teaching you what the responsibilities and duties are of the Board of Health and how boards of health are organized. The code sets out terms, but your terms are set by the people as you are elected officials that are there. We're going to identify the Board of Health and how you all carry out your duties and public health core functions. We're going to discuss your legal responsibilities and the authorities that you have. Describe public health governing structures in North Carolina and the guidelines and expectations for being an effective board member. So a Board of Health can be set up either just as a county, like we are, or districts. So there are a few counties that are put together. Of the 100 counties, there are 87 health departments in the state. A Consolidated Human Services Board is when you all have decided to put Health and Human Services together and you have one board that goes over it. Public Health Authority Board, there's only one in the state, and that is Cabarrus County, and I do not believe the General Assembly will permit those to happen any further. I think the law sunset those. And then, of course, a Board of County Commissioners, where you all passed a resolution assuming the powers and duties of the Board of Health. Public health has done a number of things over the past. Our profession literally has kind of gone in 3 phases. When we started, we were worried about the plague, things like that, cholera. Sometime in the 20th century, we shifted over to being a group that looks at chronic diseases, so think of heart disease and things like that. And now we've shifted mostly into diseases of the mind. But prevention of infectious diseases, promote and protect clean water, air, and food, works to prevent injuries, promotes and encourages healthy behaviors. We respond to disasters and have a very specific role, and we assure the quality and accessibility of health services. Some of these roles are played out by the state health department, some are by us. Some of them are state health department issues that we do for them. So, public health, the definition that we have from the Institute of Medicine, public health is organized community efforts aimed at the prevention of disease and promotion of health. It links many disciplines and rests upon the scientific core of epidemiology. Goal number 1, prevention of disease. Addressing the risk factors for disease or injury. The example they give is encouraging the use of protective clothing to limit UV radiation and exposure. Goal number 2, promotion of health, enabling people to increase control over and improve their health. So this is what we do in the health education unit, redesigning of equipment and tools, designing of buildings. So think of asking you to wear your seatbelt. The 10 greatest public health achievements of the 20th century: vaccination, control of infection, safer workplaces, motor vehicle safety, seatbelts, decline in deaths from heart disease and stroke, safer and healthier foods, fluoridation of drinking water, healthier mothers and babies, recognition of tobacco as a health hazard, and family planning. These 10 things are things that public health has done, interventions that have been created that have shown increased morbidity, increased life expectancy, and increased quality of life. Bless you, Commissioner. Additional public health achievements: cancer prevention. We know that if you do certain things, you can lessen your chances of getting certain types of cancer. Childhood lead poisoning, and public health preparedness and response, something you all got to see us do firsthand with Tropical Storm Helene. So a quick summary of that: public health main goals are to prevent disease and promote health. Great public health achievements include large-scale vaccination, healthier mothers and babies, and motor vehicle safety. Continued improvements in these areas throughout the beginning of the 21st century, but we still have major challenges. So how does the work of a governing board oversight of public health fit into the big picture? What are your responsibilities? The Future of Public Health was a report from the Institute of Medicine in 1988, and it started to set out some of the things that we should be doing. If you'd like a copy, I can get you a copy electronically. It's something you can put by your bedside if you can't get to sleep at night. It is kind of dull. But They reestablished boards of health or public health councils in some communities to assess public health needs, develop policy, and assure that the services are available. One of the things that we make sure is things are available here. If it is, we don't do it if it's unnecessary. While you'll see some health departments have clinical services that others don't, is for that very reason. Boards of health members are advocates for public health and brokers between policymakers and provision of public health services. You have a very unique role that you all are policymakers as well as Board of Health members. This wheel is the core functions of public health. And you can see that at the top part there around 1 o'clock is assessment, policy development, and assurance. Everyone in public health should be familiar with how these do, and I'm sorry they're littered. The books that you have or the presentations that you have, you can read those that are there, and I won't go into great detail on them. But these are the core functions of what anyone who works in public health should be doing. Community health assessment. You're going to hear from Miranda here in a little bit about our community health assessment. We do ours once every few years in conjunction with UNC Blue Ridge. They are required to do it as a nonprofit hospital. We're required to do it as a health department. So we, instead of trying to do one that competes with one another, we do them together. It's required every 4 years. We synchronize with hospitals on a 3-year cycle, so we do it more than is required, but we work with the hospital and get a lot of benefit from them on it. And also required are annual SOTS reports. I'm going to use a lot of initials and acronyms. If I say any that you don't understand, please let me know. SOTS is the State of the County Health. You all get that report every year at a certain time of year, and Miranda will go over that a little bit later, ours here. Boards and assessment. Assessment makes it possible for the main health concerns, factors that influence health. These are the things that are happening in the county that are influencing the health of people. Assets and resources in this community, knowing that we have this or have that. Just the other day, Brian and I were in a meeting, we were talking about the fact that we don't have a lot of housing for people in recovery. That's the kind of thing that we're talking about there. And where to intervene or create positive change. So, boards and policy making. You all, as commissioners, obviously are policy makers, but as the Board of Health, you have even more specific rules. Manage operations and management policy of the local health department. We're going to go over a lot of policies here in a little bit. Policies limited by state laws or county ordinances and policies. You all can't roll back state laws, but you could add to them if you see fit. Give advice and help the health director make decisions. Examples would be the board-approved strategic plan, which we already have in place for the next few years, and board operating procedures. A few tips for developing policies. Make sure they're written clearly and explicitly, free of jargon. They are current, include the date and renewal, available to all, brief and specific. You'll see that our policies any policy that we have is kept on a system that we have that you all have access to if you want. We can get you the printed copies if not, but it has all these things. We try to stay as free of jargon as possible. Sometimes these things have technical terms that are in them. We try to go over every 3 years and renew it or get rid of it. We do have the date renewal on all of ours, and anybody that wants to see any policy that we have, all they have to do is call and ask. That's any citizen anywhere. And we try to be brief. We don't have 100-page policies. Most of ours are 7 pages or less. And we put a lot of space in them, so it's not too big and too difficult. Assurance. Your job as a Board of Health is to assure public health services are provided, even services provided by other organizations. So for instance, if there was a service that was supposed to be provided, you could either A, direct the local health department, our agency, to do that, or B, say that this is being done by UNC Blue Ridge or Good Samaritan Clinic or some other. And you have to assure the health policies and programs are in place and working. Assurance in action. Work with the health director to anticipate trends likely to affect the department or the community. I think you guys all kind of know the trends that are happening here. Now it'll be no surprise to you when you see the next community health assessment. And you assure that public health agencies have the resources and infrastructure to provide those services. 3 core functions of public health: assessment, policy development, and assurance. 10 essential services within those core functions, and the services represent crucial aspects of your activities and responsibilities. So here's the legal authority for you. I won't get into great detail about it, but it requires that you ensure that the 10 essential public health services are available and accessible to everyone in Burke County. You can form a single or multi-county public health authority, and you may serve as the Board of Health. And this talks about who exercises the duties set out in multiple state statutes and rules. The places you can find that, of course, North Carolina Public Health Statutes, North Carolina Administrative Code. There are some federal laws that cover us, especially on some of the programs that are federally funded. And of course, the normal things like the Constitution, local rules and ordinances that you all have passed, court decisions, or any contract that we may have. So this is just a wheel of how it goes. Governing board, health department, health director. This should be kind of a symbiotic relationship where we're all in sync with one another. Sources of authority, state laws talk about the essential services, mandated services, accreditation, public health powers, duties, and programmatic requirements. The consolidated agreement, you'll start to hear more about these type of topics. You'll hear us talk about the consolidated agreement, or AAs. Those are funding sources that come from somewhere else or the state, and they run through the state and come to us. So the consolidated agreement is an agreement we have with the state for the funding that they pass to us. The AAs, or agreement addendums, are our version of the contract that comes from things like the CDC or the USDA. And then, of course, federal laws. This is that wheel again, and you can see that it lists the 10 essential public services. That's the older model from 1994. The one you saw was from just a few years ago before. There are some mandated services under state law. State regulations require that local health department either provide or ensure the provision of 12 mandated services. So you have to provide individual on-site water supply, sanitary sewage collection, treatment, disposal, food, lodging, and institutional sanitation, communicable disease control, and vital records registration. You have to provide or ensure child health, maternal health, family planning, dental public health, home health, adult health, and public health lab support. Some of those things we do in-house. Some of them are done by other people here in the community. For instance, the dental public health is done by a combination of Good Samaritan and High Country Health over at Good Samaritan's location. Accreditation. You'll hear us talk about accreditation a great deal. Burke County is one of the 2 local health departments that holds both the North Carolina accreditation and the national accreditation. Up until here recently, we were the smallest county in the country to hold the national accreditation. The North Carolina accreditation is required by state code. If we were to fail that, the state would take over all of the local health duties from the county. So we must obtain and maintain accreditation. By the way, we've done very well. We just got ours about 18 months ago, and it's good for a few years. Focus on performing those 3 core functions and delivering the 10 essential health services. There's a set of capacity-based standards that they have. There are things that we do to prove that we have met this, that, and the other. If you all would like to see the list of all the things that we require on accreditation, let me know. It is pretty long, but we can get that for you. And then we have to provide evidence of completion of the prescribed activities. Unlike the national accreditation, North Carolina's is very specific. It says, you must do this, here is how you prove it. The national accreditation asks us how we do it, and we have to work with them to prove it. So it's a little more labor intensive for that. In certain cases, we just get a letter from certain people saying that we have met this requirement. We have to provide evidence of the completed prescribed activities. We must be accredited by the North Carolina Local Health Department Accreditation Board, and the accreditation by other accrediting bodies does not satisfy the state law. So the fact that we have the other accreditation, we can't just drop our North Carolina accreditation. Obtaining and maintaining accreditation is a condition for receiving state and federal funds. So if we were to drop that accreditation, the county would not receive any funding from the federal government or the state funding in North Carolina. A consolidated agreement is an agreement that every county gets. All local health departments enter into contracts with the state in order to receive those federal funds, and it tells us what we have to do in order to do that. It imposes some programmatic and administrative requirements. They're not really overly burdensome, and it does have some service mandates, but those are outlined in North Carolina code. Some of the examples, the anti-discrimination rule, HIPAA privacy, Civil Rights Act, personal responsibility and work opportunity, strings attached to Title X programs. Those are around family planning. Those, all of those that you see are something familiar to any healthcare facility, so it would be very similar to that. Local health directors, this talks a little bit about how we're appointed. As a county or district, I am appointed by you. There is a minimum education and experience that I have to have. If I don't meet those requirements, that you have to submit to the state health director when you hire a director, and they have to tell you whether that person is or is not qualified. If they are not qualified, you may not hire them. It talks about some of the other laws that are there. The Public Health Authority and Consolidated Human Services Agencies have different requirements for those positions. All of them do have requirements in terms of the education and experience. Most of us have a Master's of Public Health degree. There are a few that can get by with a nursing degree on a program that was started a few years ago. The health director has to be an administrator, enforcer, educator, community liaison. So not only do we have clinical responsibilities where I'm an administrator, but we do have enforcement responsibilities with environmental health and also with some of the orders that the health director can give. So some of the examples you see here: employ staff, prepare budget, administer programs, communicate with you, enter into contracts. From an enforcer standpoint, immunization requirements, those are required at the school level. Quarantine and isolation. Interestingly enough, during COVID, I did not have to sign any quarantine or isolation orders for COVID. I was very, very pleased that our citizens were pretty good about that. Investigating communicable diseases. There are a number of diseases that you're going to talk about a little bit later that are requirement for reporting. If you get a diagnosis of that, it has to be reported to us if it happens in Burke County. Abate nuisances and hazards. This one's really tricky with us because I'm sure that you all have gotten a phone call that my neighbor Billy's property isn't this or property isn't that. We get a lot of those calls, and we have to investigate if there is something that is considered a public health hazard. And we can impose penalties. As an educator, we communicate health issues, promote health benefits. We advise public officials, whether that be you or the state legislature. We coordinate with anybody here in the community and collaborate with those in the community. Talk about you all. You show up the responsibility to protect and promote the public health. That is your major responsibility as set out in the general statute. This is a little bit old. They haven't updated this presentation for a couple years. This is how public health agencies and boards are organized across the state. And you can see it's different between a lot of counties. Most counties are in that white, which are health departments with a county board of health. The pink, Burke County would be in the pink now. We're one of 5 that has the Board of Commissioners serving as the Board of Health. And then there's others where there's a district health department with a district board of health, a consolidated human services agency with a consolidated board of health, or a consolidated human services agency where the Board of Commissioners serves as the Board of Health. If there is a Board of Health, you all have other requirements that say this, but you must be residents of the community appointed or removed by the commissioners, and the composition is dictated by statute. The health director serves as the secretary. The advisory committee that you all established when you took over the roles as responsibilities still has to follow these rules right here. So you have rulemaking, adjudication, and administration functions. You have the responsibility to protect and promote the public health. You'll have the authority to adopt rules as necessary for that purpose. A Board of Health rule is something that prohibits a citizen from doing something or requires a citizen to do something, is enforceable in court, and a person can be charged with a misdemeanor, subject to an injunction by a judge, or fined by the health director. Some jurisdictions have local rules about private drinking wells, on-site wastewater, mosquito control, or wearing masks in public places during an emergency. I don't think really those are that necessary for Burke County. A lot of the more rural counties have to have some specific rules because of the nature of their septic system, their sewage system. Interaction with other state rules. You can make things that are more stringent unless code says that you can't. And it's only if a more stringent rule is required to protect the public's health. So as the Board of Health, you all have that dual role, so it's a little different for you. Must be related to health, must be regional, and may not discriminate. Addressing limitations for local Board of Health rules. Food and lodging and sanitation. Local rules are generally not allowed. Private drinking water wells, local rules must adopt and supplement state rules. On-site wastewater, local rules must adopt and supplement state rules, and the state must approve any local rules that you all create. And smoking. Local rules may regulate smoking in specified places. The Board of County Commissioners must approve those local rules. So if you all wanted to say that people can't smoke in this or that, that's above and beyond what state code said, you all would have to go through that process right there. Adjudication. You all will act like a court. You all have had that experience here recently in another manner, very similar to something that would happen if someone was aggrieved, and there was a question about interpretation or enforcement of a local Board of Health rule or imposition of fines or appeals. You may be asked to hold a hearing about the enforcement of Board of Health rule or imposition of fines. And in the adjudication role, you act as a quasi-judicial body or court. I believe you all have gone over this here recently with some of the more housing-related issues that you've had. But you have to have, you consult with your local counsel, you have timelines that you have to follow, you have to keep the verbatim transcript, issue a written decision, and follow the procedures described by state statute. Your decision may be appealed to the district court. And as administration, here is, you identify a candidate, the state health director has to evaluate the education requirements. You all are the ones who set the budget, the director's salary, and you all are the ones who regularly evaluate my work. You may impose fees for services to be rendered at local health department, except where it's prohibited by statute. So for instance, when someone gets a septic permit, you all are the ones that set the fees for that permitting process. The budget, just like you do as a county commissioners. As a Board of County Commissioners, the consolidated health departments and community must approve the departmental budget, but it's not a big deal for you all, as you all are the budgeting authority in the county. So it's a quick summary: legal responsibilities and the authority of public health in North Carolina and the sources of public health laws, roles and responsibilities of the health directors and the Board of Health. I've gone through a lot real fast. Did you all have questions? Great. Public health governing structures, board member roles, and effective governance. You may assume the powers and duties of Board of Health, as you have. You could create a consolidated human services agency or do both. This is the process that you went through to assume those roles. You had to give the notice of public hearing, have the hearing, and adopt a resolution. Your authority over of Board of County Commissioners extends to health, social services, consolidated, or any other board or commission appointed by the Board of Commission that acts pursuant to the Board of Commissioners' authority. The MHTD-SAS Board, the Public Health Authority, public hospitals or public hospital authorities, and multi-county boards are not included in this. None of that matters to Burke County unless you will decide to take any of those on. Your powers and duties are to appoint the local health director, make policy for local public health agencies, adopt local public health rules, adjudicate disputes, impose any fees, and satisfy state accreditation requirements for boards of health. Here's your advisory committee that you all set up. It still has to continue those same membership with the people that are there. You can add more to it, but you cannot take away from those. Here are the powers and duties, the commission versus the advisory committee. You have all the legal powers and duties automatically by law. You adopt any of the public health rules. You adjudicate any of the disputes, and you acquire any additional statutory duties. The advisory committee can advise you on public health matters and carry out activities that may be delegated to an advisory committee based mostly on accreditation. So here are things that you cannot delegate. This training, my apologies to you. Assure development and implementation and evaluation of local programs, establish public health goals, assure resources to implement essential public health services. The things you can delegate are to review the assessment data and citizen input. You can plan and monitor progress. That advisory committee can plan and monitor progress, support public health funding and programs, and community health improvement. They can advocate for public health and promote community-based partnerships. The Board of County Commissioners that assume the powers of the Board of Health has the duty to retain the legal authority and adopt local public health rules. You may not delegate that, and you may ask the advisory committee to advise on rules and assist in developing and promoting any of those rules. For me, it continues the same minimum education and qualification requirements for a health director. Must have a background in medicine, public health, or public administration related to health services. Guidelines for members. You represent public health to the community. You also speak for the board when delegated. Work to link the community to the health department and act as an advocate for public health by maintaining active involvement with the health department. As the chair, commissioner, here are your roles and responsibilities. You're the leader of the board. You run the meetings, speak and represent the board, promote teamwork. You've been at this for a while. You know all those things. You will have to initiate the strategic planning. We've got a few more years before we go into another strategic planning process. You will initiate the annual evaluation of the health director and work with the health director to set the meeting agenda for these. You counsel and consult with the health director. Removal doesn't matter. As you all are elected officials. You have to have a quorum. All matters discussed must be recorded in the minutes. Approvals must be recorded in the minutes, and minutes must be preserved. Of course, work under the North Carolina Open Meetings Law. We maintain a manual and operating procedures. If you have committees or subcommittees when appropriate, including members from outside the board, your overall rulemaking, adjudication, and policymaking, leave the day-to-day operation of the health department to the health director and to develop and support policies designed to promote and protect the public's health. Your number one goal is to support the health department in achieving its goals. Summary, you should educate yourselves, be involved in board meetings, seek to link community to the health department, represent public health, speak for the board when delegated. Of course, the meetings have to follow specific guidelines. The chair has certain roles. The board's overall roles are rulemaking, adjudication, and policymaking, and your number one goal is to support the local health department. Governing challenges would be vague task definitions, no hierarchy, little feedback, or open meetings. Governing well, work as a team, think and act strategically, focus on policy priorities, master your decision-making, and of course, allocate your time or energy appropriately. Set clear rules, provide oversight. These are all things that you all have done as a board for a number of years now. As a team, of course, commit to work together, open communication, disagree without being disagreeable. Levels of board accountability, you're accountable to yourself, the rest of the board, the health director, and the staff of the health department, the citizens and community of Burke County, and of course, North Carolina and the nation as a whole. 6 expectations for board health director relations. The board as a body sets directions. The board respects the role of the health director as chief administrator for the role of the health department. The board and the health director jointly strive for good service for community. The board is responsible for board members' behaviors. The board freely gives and seeks feedback, and the board works with the health director to be a high-performing and governing body. This is just a matrix that shows that if you are low control and low health director control, you're basically a caretaker. The goal would be to have high control for the governing board and high health director control so that there's a balance or shared involvement. So it is an honor to serve on a governing board for public health. Serving as a governing board for public health is a very weighty responsibility. You should strive for partnership and provide good service to the community here. That's our ultimate goal. I went through that rocket fast, gentlemen. Did you have any questions? You have met your requirements for this. Thank you very much.
Thank you, Danny. All right, gentlemen, at this time we will need a motion to acknowledge receipt of training and the written handbook in accordance with 10A NCAC 488-1303. Do I hear a motion at this time?
Mr. Chair, I make the motion.
Thank you, Mr. Vice Chair. All those in favor signify by the uplifted hand. 4-0, Madam Clerk. All right. This brings us to scheduled public hearings. Have anybody today to speak at our public hearing? I'll open the public hearing at this time. Seeing no one, I'll close public hearing. We have no consent agenda for this meeting today. This will take us on to item number 10, items for decision. First item comes from the Board of Health, approval of 2025 rules of procedure. And gentlemen, you've had these rules of procedure for a number of days to review. They're very similar to our county commission rules of procedure. Those things that did not apply were removed, that left those that are applicable to the Board of Health. Any questions concerning those? Seeing here none, I'll entertain a motion to approve the 2025 rules of procedure for the Burke County Board of Health as presented, subject to review and or revision by the county attorney. Do I hear a motion?
So moved, Mr. Chairman.
Thank you. All those in favor signify by the uplifted hand. 4-0, Madam Clerk. Item number 2 from the Board of Health, adoption of resolution establishing commitment to an equitable adjudication process. Gentlemen, you heard our director talk about that a little bit already. Any questions on this item? Seeing here none, I'll entertain a motion to adopt resolution 2025-01 as presented.
I'll make the motion, Mr. Chair.
Thank you, Mr. Vice Chair. All those in favor signify by the uplifted hand. 4-0, Madam Clerk. This brings us to item number 3, approval of the Health Director's job description, acknowledge completion of annual review, and approval of recruitment and retention policy for agency staff. Gentlemen, we did review the director's work back a couple months ago. Any questions on this item? Seeing here and none, I'll entertain a motion to approve the job description for the Burke County Health Director and acknowledge completion of the local health director's 2024 annual performance review.
So moved, Mr. Chair.
Thank you, Commissioner Barrier. All those in favor signify by the uplifted hand. 4-0, Madam Clerk. This brings us to item number 4, Health Director approval of Health Department policies, part number 1. This presented by Mr. Scalise, our local health director. Mr. Danny.
I'm going to try to go through all 3 of these next items very quickly. The first, part 1, is broken out as the Health Department's approval of the Health Department policy on policies. And it has policy on policy, tobacco cessation, staff orientation, and our financial fee and eligibility policy within that. All those policies were in your packets previously. If you have questions, I have copies of them right here and can answer any questions, or I brought staff here to answer any questions on those first ones. We can move on if you don't have any questions, sir.
So moved, Mr. Chairman.
Thank you. All those in favor signify by the uplifted hand. It's 4-0. Item number 5, approval of Health Department policy, part number 2.
Same as before, Commissioners, you have those policies in your packet. I'm going to go over these. These are a little more detailed, and I have some jargon that's in these, so please stop me if you have questions. But the 340B, purchasing and inventory policy, birth control follow-up for prenatal clients, policy and procedures, cleaning of the clinic area for medical instruments and equipment policy, environmental health water samples policy, maternity clinic policy, newborn metabolic screening policy, non-discrimination policy, observing public health laws, rules, and regulations policy, performance management and quality improvement policy, purchasing payable policy and procedures manual, purchasing policy, quality assessment policy, quality improvement plan policy, test systems backup plan, the Title VII of the Civil Rights Act policy, Title 10, staff orientation and training policy, and our policy on tuberculosis.
All right. Thank you, Danny. Any questions on any of these policies? We've had these in your possession. Any questions? Being here none, I'll entertain a motion to approve the aforementioned operational and clinical policies as presented by the local health director.
I'll make the motion, Mr. Chair.
Thank you, Mr. Vice Chair. All those in favor signify by the uplifted hand. 4-0, Madam Clerk. Item number 6, approval of various Health Department administrative policies. Mr. Scalise.
All right, I'll follow the same format. Acceptance of personal and business checks, CLIA reference numbers, client records management policy, community education and outreach policy, community engagement in public health policy, conflict of interest policy, customer complaint policy, consumer complaint policy, consumer complaint procedures, cultural diversity and sensitivity policy, customer satisfaction policy, customer satisfaction procedures, delegation of duties to the health director, dress and appearance code, electronic records and imaging policy, health department code of conduct, information security training policy, language access policy, maintaining privacy and direct service areas policy, media and communications, research policy, and standard purchasing requirements.
All right, thank you, Danny. Gentlemen, you've heard this information. Any questions on these administrative policies? Seeing here none, entertain a motion to approve the aforementioned administrative policies for the Health Department as presented.
I'll make that motion, Mr. Chairman.
Thank you. All those in favor signify by the uplifted hand. 4-0, Madam Clerk.
Thank you, Commissioners.
Thank you. This brings us to item number 7, Community Health Assessment and Community Health Improvement Plans. This is going to be presented by Miranda Smith, our public health educator. Good morning.
Good morning. Did you put the clicker?
It's right underneath the...
Sorry about that. Good morning, gentlemen and Adam. So before I get into the community health assessment and the community health improvement plan and the state and county health report, those reports were given to you. I put together a presentation that kind of highlights the key data and information from those reports to kind of save some time. Danny did mention that we work in a 3-year cycle with UNC Health Blue Ridge. So I want to kind of explain how that cycle works. So when I talk about this, if you have any questions, you can let me know. So the community health assessment is every 3 years. We partner with UNC Health Blue Ridge. The community health assessment, we use primary data sources, data collection where we do surveys and we do focus groups within our community. And then we use secondary data sources where we collect data from the state, CDC, things like that. We put that together and we have a initiative coalition here for county where we get together and we vote and we look at the data to pick 3 health priorities. After those health priorities are chosen, we then create the community health improvement plan, which is a plan that is set in place to help address those health priorities. In that plan, we select programs that are within Burke County or suggest programs that need to be created to help address these priorities. Then after that, we have the state and county health report that is submitted to the state every year following until the next community health assessment. This state and county health report allows us to see how these programs are impacting these priorities that were chosen and if there's been any major development or health issue within the county that may impact those health priorities, such as with Helene. So the background for the 2022 Community Health Assessment, data collection began in September of 2021. Data was collected through focus groups and surveys. It was collected by Burke Wellness Initiative, which is an initiative here that we run with the health department that has community partners, organizations, and other individuals throughout the community. It is an open group, so we keep a list of all those members if you would like that. So the results of the survey The results of the survey was 2,149 responses. The Burke Wellness Initiative also did 9 focus groups, but only used data from 7 of those focus groups. After all the data was reviewed, they had 6 different health priorities, and after chosen, they picked 3 of those. Before I get into those priorities, the Community Health Improvement Plan from the 2022 CHA was submitted in September of 2023, and the State and County Health Reports were submitted in March of 2024 in this year of March. So the first priority that Burke Wellness Initiative chose for the 2022 health assessment was mental health. The big key data point that really drove that decision was out of the 2,149 individuals, 888 people who took this survey said that mental health, anxiety, and depression impacted the overall health of the individual the most. The program that was selected for the Community Health Improvement Plan was the Community Paramedicine Program with our amazing community paramedic, Tina. The next priority is substance use disorder. From 2012 to 2019, Burke County was one of the 2 counties in North Carolina that had the highest rate of drug overdose, which you are all familiar with. So the Community Health Improvement Plan programs that were selected were the Eat, Sleep, and Console program with UNC Health Blue Ridge Labor and Delivery Unit and the Burke Recovery Court program. The last priority was obesity with risk factors. In 2022, 36% of adults within Burke County were labeled as obese. The high obese percentage was partly due to the lack of access to fresh fruits and vegetables. Of the food hardship index, we scored 0.27, and we scored 33rd out of 200 counties. The closer that the number is to 1 is the higher it is to get access to these fresh fruit and vegetables. So the programs that were chosen to combat this priority were the Women, Infant, and Children, our WIC department's fresh food voucher program, where individuals are able to take this voucher to farmers market and grocery stores and get fresh fruit and vegetables. And the last program was C2 Life Thrive Food is Medicine. Lastly, we are finishing conducting the 2025 Community Health Assessment. The next trial is slated to be presented to you all in November by me, and I'm excited to talk about that and show you all how the data has come together this past year and to see how those health priorities will impact our communities the next 3 years. Any questions?
All right, thank you. Any questions on this item? All right, seeing, hearing none, entertain a motion to accept the reports as presented.
Motion to approve.
Thank
Accept.
you. All those in favor signify by the uplifted hand. All right, gentlemen, we've been going about 50 minutes or so. Let's take a short recess. We'll break for about 15 minutes, and then we'll come back and keep moving, okay? Well, rarely do you guys want to keep moving, but it seems like you didn't even take your 15 minutes this morning, so I'll take that as a clue. And Madam Clerk, we'll note that Commissioner Stroud is now with us, so that gives us all commissioners present. And with that, I'll call the meeting back to order. And with that brings us to item number 8, Health Department Communicable Disease Update and Policy Approval. This will be presented by our Health Director, Mr. Scalise.
Thank you again, gentlemen. You have the policy within your packets, so I won't go over that too much. And we have the communicable disease report on the screen. Okay, was that part of the, there we go. That's a lot to see there. You have that in your packet, and there's a lot of diseases that are reported to the health department. So all of these are things that are reported, and these are the cases that we've had over the last 2 fiscal years. So it'll give you an idea of some of the things that we see. You can see that we've lowered the number of chlamydia, which is something that's been a little bit of an issue throughout this community. We've seen a little tick up in hepatitis C, and for the most part, a little tick up in syphilis. Most of the others are smaller. You can see the ones that are on the bottom that are required reportable diseases, and we have 0 cases, which we're very happy to see that we don't have malaria or measles or some of those other nasty things.
Danny, for somebody that don't know anything about chlamydia, tell me what that's all about.
It is a sexually transmitted infection. It's pretty nasty. It's something you don't want.
I guess it's a good thing I don't know too much about that. So, okay. Any other questions or comments on this item? All right, gentlemen, no questions. I'll entertain a motion to approve the communicable disease surveillance, investigation, and reporting policy and procedures as presented, and to acknowledge receipt of the communicable disease update.
So moved, Mr. Chairman.
Thank you, Commissioner Berry. All those in favor signify by the uplifted hand. 5-0, Madam Clerk.
Thank you, Commissioners.
Fatality Prevention Team. This will be presented by Miranda Smith. Miranda, thank you.
Hello again. So the Child Fatality Review Team meets on a quarterly basis. We're required to present this report to you on an annual basis. I won't go into much detail as you have this report in front of you, but I do want to hit some data points and kind of talk about what the purpose of Child Fatality Review is. We get together and review this. I also want to take a step back and say that this report was off the previous legislative rules. After July 1st, those changed, and I've been working with Kay to make sure that we follow those and have all those correctly in order. So we review every child death under the age of 18. After COVID, the requirements and the accuracy of how much we met kind of slid off. So we have revamped that back in July of last year. And from that, we went over data from 2018. From 2018, there were 65 child deaths, ranging from having unsafe sleep, accidents, prenatal conditions, illness, homicides, natural causes, drownings, and even those that were labeled undetermined. From those deaths, as child fatality, we got together and looked at what we could really do to help address those child deaths, as we want to prevent as many as we can. And we really looked at safe sleep, as that's something that is easily preventable. So we have put together an education plan around safe sleep to help promote and educate members of our community in partnerships with UNC Health Blue Ridge, their labor and delivery unit, and as well as maternity offices throughout Burke County. We have social media that will be promoted and put in place, as well as educational in-person trainings and informational subjects. The last thing I want to talk about for the child fatality is the funding that we receive. Every county in North Carolina receives a small amount of funding that goes towards child fatality initiatives and reporting. We were able to purchase 78 sleep sacks that is divided between Burke County Public Health, Department of Social Services in Burke County, and UNC Health Blue Ridge. We purchased 17 pack and plays to also share among Burke County Public Health and Department of Social Services. And we also purchased one smart outlet sock that can be used for any family that may have a medical emergency for their child. We really want to put initiatives in place that helps prevent any child death that has to do with unsafe and sleep and sleep environments. And that's kind of the overall purpose of child fatality. We review these child deaths and give these children a time of respect that they deserve to talk about what could be prevented to losing their life and how we can do that in going forward to prevent deaths of other children. Any questions on that report?
Any questions for Miranda on this report? Miranda, in the accident group, is there anything common about those accidents that comes to mind? I know that puts you on the spot.
The accidents, the 9 that are classified, they all range in different things. It could be from a car accident, it could be from a tree incident, anything environmental outside. They all range in different ways. We review the case a year after the medical examiner has received that information and done the examination. So we get all the details afterwards that we look at the cases. So everything has already been classified when it gets to us and determined what kind the cause of death is. So they're all kind of different. They range in different aspects.
Okay. All right, thank you very much. Entertain a motion to accept this report as presented.
Mr. Chairman, I make a motion to accept the report.
Thank you, sir. All those in favor signify by the uplifted hand. 5-0, Madam Clerk. All right, this brings us to item number 10, clerk appointments to the Child Protection Committee. Madam Clerk.
Let me get all my computers aligned. Okay, Mr. Chairman, members of the board, this is a request mostly for record-keeping purposes to appoint Dr. Sean Ham to the Child Protection and Child Fatality Prevention Team, seat number 10, healthcare provider, to complete the remainder of a 3-year term ending April 30th, 2028.
All right, thank you, Madam Clerk. Gentlemen, you've heard this motion or this appointment. Do I hear a motion to appoint Dr. Sean Ham to the Child Protection Fatality Prevention Team, seat number 10, to complete the remainder of a 3-year term ending April 30, 2028?
Mr. Chairman, I make that motion.
Thank you, Commissioner Burns. All those in favor signify by the uplifted hand. 5-0. All right, that brings us to reports and comments. And Mr. Manager, just before we take off and kind of leave the health reporting area, I asked Danny, since we were running on good time, it appeared this morning, to perhaps give us an update on a couple areas that we've been working on within the health department, sanitation inspections and health restaurant inspections. And he's going to take just a moment to do that for us this morning.
Yeah, I really appreciate this, Commissioner. I think this has been a great improvement for us. Sometime, and I've been told it was 2009, so it's obviously before my time, the county was in a little bit of trouble, and when you all had some vacancies, you all took, well, not you all, but the previous commission took 3 FTEs out of environmental health. Those were restored last year, and since that time frame, we've gone from having 1.5 FTEs that are doing restaurant inspections and 1.5 FTEs. Now that we have those 3 other additional FTEs, we took our food and lodging. In the middle of the year, it looked like we were going to have 50% of the required inspections done, which was a problem for us. We made our way to 88% in the last fiscal year of the required inspections, and this year we should have 100%, long before the end of the fiscal year. Having those 3 FTEs made that exceptionally helpful. On the on-site, when we first talked about it, we were 8 weeks behind. Now, if you apply for something within 4 weeks, you should get your permit, which is about as fast as we could actually do it, considering all the moving parts that are in there. Of the people that are waiting right now any longer than a couple weeks for anything, almost all of them are there because they haven't got their zoning permit, or they didn't fill out something, or they didn't bring something there, and we have communications to them saying, hey, we need this before we're able to issue your permit. So I think that's about as fast as it's going to get. It's as fast as anybody around here is doing. And I think those FTEs is what made the difference. Thank you.
All right, thank you, Danny. Any questions on this item?
I'll just brag on the whole team, even Scott back in the back. We on top of the additional staffing horsepower, which was all reclassifications of existing positions that we've talked about. We also, IT, the health department, worked performance management function to create an ArcGIS map that is updated real time, and there were some changes to how we dispatch inspectors and how we prioritize applications on intake. So it's really, I think, been a remarkable turnaround. Tip my hat to the whole team. I think the IT department and the health department jointly received a NACO Innovation Award for that technology improvement too. So I think a combination of both protocol and staffing have made significant improvement.
Thank you. Have questions, comments? And Madam Clerk did remind me that the appointment that we just made for Dr. Ham needs a residency exception. Dr. Ham does not live in the county. So gentlemen, can I have a motion to abide a residency exception for Dr. Ham?
Mr. Chairman, I make a motion to waiver the residency requirement for Dr. Ham.
Thank you, Mr. Smith. All those in favor signify by the uplifted hand. 5-0, Madam Clerk. Thank you. All right, now we'll come to reports and comments. This is, first one comes from the county manager, update on the Human Resource Center renovation project, and Mr. Manager.
Yes, sir. At your last county commissioner meeting, the board's well aware that we presented the RFQ process for and recommended Holland and Hamrick as the design architectural firm. We have received a contract, and that's been executed. The proposal is at 7.1% for design, development, permit drawings, as well as construction administration of the anticipated project cost. So we're beginning to mobilize. We'll be putting together a construction steering committee likely in the next week or so. Obviously, the holiday, the 4th timeframe was a little bit of a challenge to do a kickoff, but optimistic. The milestone dates that we put into the contract allowed for a summer 2026 full set of permit drawings and bid drawings, and optimistic that about an 18-month build out, which puts us at 12/31/2027 for substantial completion. Those are the milestones we're trying to hit. So continuing to evaluate alternative outside funding opportunities, and also preparing for that construction budget in-house simultaneously on a parallel track. But excited that it's well underway and moving, and we're largely have the team together. And I'll be providing periodic updates to the board as we move forward.
All right, thank you, Mr. Manager. Any questions on the renovation project? All right, hearing none, I'll entertain a motion to accept the information as presented.
So moved, Mr. Chairman.
Thank you very much. All those in favor signify by the uplifted hand. 5-0. All right, item number 2, Board of Commissioners reports, comments, and supplemental information. Gentlemen, any further information that we need to receive this morning?
Mr. Chairman, in terms of comments, and I'm sure I'll be joined by others, but the situation that was dealt with yesterday, I just want to commend our staff for the professionalism, the urgency that they went about making all of that happen while keeping cool. Figuratively, there was no cool yesterday out there. I had an opportunity to go by Foothills Higher Ed for just a few minutes, and it was like a well-oiled machine, and I just want to congratulate our staff and tell them how in awe I am of everything that was accomplished yesterday. It was amazing.
Mr. Burns, though, I think I know what you're talking about. Specify, you didn't exactly say what you were talking about.
Okay, the fire that broke out at Grace Heights yesterday, they were able to move 92 residents. They were able to triage on site and then move some to the emergency room in the hospitals, and some were, I think 65, maybe 70 were taken to Foothills Higher Education Center. It was, I don't know, I sit back and look at operations like that, and I know there is planning that goes into it, but it just blows my mind that all that happened in the time frame that it happened, and it seemed to move so seamlessly.
Thank you. I appreciate those comments, and I too was familiar with that and heard some community comment of how folks were so pleased with the folks that had family members involved in that move, and folks getting from Grace Heights to other places. And I heard great comments as to how that was managed and handled. So thanks to all of our folks in the community who helped with that, and it was, I'm sure, a tremendous task to manage. Any other comments this morning? All right, seeing here none, this will bring us to item number 12, Board of Health Advisory seat. Do we have for this veterinarian, do we have something on that matter?
No, just a way of an announcement.
Okay. All right, if you can help us with, maybe you know a veterinarian who could help us with this vacancy, that is open, and we would love to fill it. That brings us to closed session. We have no need for a closed session this morning. And then that will bring us to adjournment. But just before we adjourn, I know that Madam Clerk has arranged a wonderful lunch for us, but it's 9:15, and I don't think we're ready for that. So, Madam Clerk, can we provide invitation? Where will that food be? Where can somebody eat that food after a while? Anything you want to note at this time?
Happy to share, but the hot dogs aren't cooked yet.
Okay.
So if your crew would like to, come get it, happy to pass that on.
All right.
The beans are hot and the chili's cooking, but we got all the fixings.
Okay, well, James, maybe EMS, that might be a good idea, or Madam Clerk, you just work that out as you ably will, I'm satisfied. So we just don't want the food to go to waste. So there you go. Gentlemen, any other questions or comments before we adjourn?
Mr. Chairman, I want to know if hot dogs are within the dietary requirements recommended by our health director.
I think you have pushed that limit right there, but I'll let Danny speak to that. Okay, a wise health director has spoken. Okay, thank you very much. With all of that, thank you guys for being here this morning. Appreciate your attention to these important matters. And again, want to thank our health department for being prepared and taking care of this morning, and appreciate all the work that you guys do every day for our citizens here in Burke County.
Much love, much love.
Thank you very much. All right, well, with that, I'll entertain a motion to adjourn.
I'll make that a motion to adjourn, Mr. Chairman.
Thank you, Commissioner
Since I was
Strauss.
late.
All those in favor signify by the uplifted hand. Madam Clerk, we are all in accord, 5-0. Thank you very much for being here this morning.